Hey everyone, it is Dr. Jeff Williams, your favorite Amarillo chiropractor, and I am here to discuss, is it a disc herniation causing that low back pain of yours? There are lots of reasons to suffer from spinal pain, and the severity of spinal pain can run the gamut from minor aches to really debilitating pain that can hurt so bad you become nauseous. If you've ever suffered from that kind of pain, you know exactly what I'm talking about. It can be difficult just to try to get yourself to the restroom, right? That's some serious pain. In this day and age, one of our first reflexes when we hurt like that is to take to the internet and try to find out exactly what's going on. And we call this visiting Dr. Google. As we all know by now, Dr. Google, he's going to have us all shopping for a funeral home and a cemetery plot. Our point in this video here is not to diagnose anyone from hundreds or thousands of miles away. Instead, we want to try to provide you with some general rules of thumb that may be helpful in allowing you to decide which direction to proceed towards recovery. Now, here's the first rule of thumb we're going to give you, and it's extremely important, folks. If the pain in your back is causing you difficulty controlling your bladder and bowel functions, or you have like pins and needles or numb feeling in the area that would typically come into contact with a saddle if you were to sit on one, that's called saddle anesthesia, and you need to go to the emergency room ASAP, urgently. This condition is called Cauda Equina syndrome, and it needs to be treated directly at the hospital by medical professionals. Okay. Now that we got that out of the way, let's run through some general ideas and rules of thumb when trying to decide what that is causing your back pain. When we talk about sitting, standing, or lying down, disc patients are typically most uncomfortable when they're sitting and most comfortable when lying down. When we lay down, we take the weight off of the discs in our low back, allowing any potential bulge or herniation to reduce a little bit so it can alleviate the discomfort for disc patients. Now, going from a seated to a standing position, that can be pretty difficult for disc patients. Also, the inability to raise both feet, like if you're lying on your back, raise both feet about 6 inches and hold it for 30 seconds. If you can't do that due to the pain, that might suggest that you have a disc condition. Pain when you cough, sneeze, or bear down can suggest a potential disc condition. If, when pointing to your pain, you point directly over the center of the spine, as opposed to just off the center, or even several inches to the right or left, then it might suggest that you have a disc condition. If you would point just off center, then we're talking about maybe a facet issue. And if you point away from the center and down just a touch, well, it might be a sacroiliac or an SI joint that's causing your pain. Over the center, though, maybe a disc. Now, if you have pain, numbness, or tingling into one or both legs, it can be due to a nerve root or disc issue. Several conditions can cause pain into the hips and certain aspects of the legs, but as a general rule, the further the pain goes beyond the knee, the more likely you're dealing with a disc. If it starts hurting in the first 1/3 of trunk flexion or first 1/3 of trunk extension, could be a disc causing that pain. If bending forward or backward causes the pain to peripheralize, which means that the movement causes the pain to spread out and run further down into the hips, buttocks, or legs. While there are certainly more generalities we could offer, these are a good way of guiding your thought process initially. Now, what happens if it is a disc? After going through this article, you may very well feel, yeah, it might be a disc. Sure sounds like what Dr. Williams is saying. What does that mean to you? Well, it does not mean that you should start shopping for a surgeon. The only thing that means is that you should start shopping for a practitioner that is schooled at treating a disc bulge or a disc herniation safely, effectively, and conservatively. That's important. Many doctors of chiropractic are very skilled and capable of managing your disc herniation safely through the use of not one treatment, but through the use of many, such as gentle non-surgical spinal decompression, spinal manipulative therapy, targeted and specific exercise rehab, low-level laser treatments could be helpful, myofascial muscle work, yoga classes, physiotherapeutic modalities, and things along those lines. Now, chiropractic adjustments are just one tool of the chiropractor. It is but one tool in a whole garage full of tools. The best patient outcomes typically come from the skillful selection of a combination of these tools fitting each individual patient, with the American College of Physicians now recommending spinal manipulative therapy as a first-line treatment for acute and chronic low back pain. It's clear where these disc patients should begin their journey to recovery. In addition, I authored a research review for the American Chiropractic Association's blog discussing a paper that proved spinal manipulative therapy is more effective than a common medication called diclofenac that's used for acute low back pain. And to bolster our case against shots and surgery in the beginning, the literature has proved epidural injections to be mostly ineffective, and if they do work at all, they are typically short-lived with no long-term effect at all. And when you combine this with the information that 56 million people suffer from low back pain, and ultimately only 5% of those actually need any kind of surgery, well, the picture begins to become very clear. We tell our patients all the time, epidural injections, pain doctors, and surgery will always be there. They're not going anywhere, folks. So it makes sense to have a trial run of safe, non-invasive, non-pharmacological means of treating your disc issue first. If we can't get you there, we'll find someone who can. That's about as fair and as sensible as it gets. If we can help you determine what's going on and how to get the help you need, then call us at 806-355-3000 for a free consultation. We'll even be glad to review your MRI for you at no charge if you already have one. Again, this is Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas. Come see us.